I take great pleasure in introducing my colleague from class of 2006 from Colorado, the great state of Colorado, Mr. Perlmutter.
And I thank my friend, Mr. Yarmouth, and I want to follow up on that. The last few months in Colorado, as well as every place else in the nation and other places in the world, we've been talking about how do we finance health care? How do we finance it in Colorado, in Kentucky, wherever it might be? But that subject really leads to so many other conversations because the health care system touches every life in America, 300 million plus people. And I can tell you from the Perlmutter family, from my family, the passion really has been evident. Because there are some things in this system that are broken, and we have to fix them. There are some things in the system that are working, but they can be better. And we need to do this in a way that's affordable to all Americans. And let's start with what's broken, because that's something that affects my family, and I know thousands and thousands and thousands of families across the country, and that is the discrimination that is suffered by people with prior illnesses. One of my kids has epilepsy, and if she doesn't have a job where there's group health insurance, she's going to be denied coverage or be placed in a situation where the cost of her health care is going to be way beyond her means. Thank goodness she has a job where there is group health insurance, but if she were ever to leave that job or lose that job, she would be in trouble. And she's like so many other people around the country who face this discrimination. And from my point of view, that discrimination is just wrong, and it's probably unconstitutional under the 14th Amendment to the Constitution. All of us equal protection of the laws of this great country. So there's a place where we really have a problem in the healthcare system where people who have prior illnesses, prior conditions, can't get coverage, or they can only get coverage at prices that are out of sight. Now, I don't fault the insurance companies on that. They're insurance companies, and they want to insure individuals and people who aren't sick. I don't blame them. That's how insurance works. If you insure somebody who's sick and you know it's going to cost you, then that doesn't help the shareholders, and that doesn't help the company as a whole. But that's what's wrong with this, and that's why we've got to change it. And I compliment the President and the members of this House who've had the guts to step up and deal with this issue, because it is a major issue and a major change to policy that we have here in the United States, which is to cover people with prior illnesses. That's number one. And I can tell you, in my district, in Colorado, almost everybody thinks that that needs to be changed. So we're dealing with something that is fundamentally wrong within the system, and it's something that almost every family can understand and relate to, because they either have somebody within the family or they have a close neighbor or friend who has some kind of illness, number one. Number two, we've got to fix something that every small business and individuals are seeing, and that is the increase in premiums year after year, and deductibles increasing, so that the cost of your health insurance just keeps going up without any end in sight. And so we're trying, as part of this legislation, to put some restraints on this so that we slow these increases down so that businesses and individuals can afford insurance. This is part of the menu, the choices that we want to bring as part of the legislation, so that there is competition and choice and availability to small businesses and to individuals so that they can acquire insurance, so that, God forbid, something bad happens medically or within the health of their family or their employees, that there's coverage. So we're trying to deal with two very fundamental problems with our health care system today. One denying people or discriminating against people with prior illnesses, and two, trying to put some lid or restraint on the ever-increasing premiums that we see to small businesses and to individuals so that they have a place they can turn to get insurance that isn't going to break them in half. Now, we can improve things that are working. And one of those places where we really do have some great success stories and we can build on those is in the research that the country and our medical universities are conducting throughout the nation. We are in the cusp of some tremendous breakthroughs when it comes to heart disease and cancer, two of the things that are so expensive to both individuals and businesses and the nation. So if we can continue to really develop this research and continue to provide resources for research, there is hope and promise on some very difficult diseases that ultimately we can overcome. And so it's with these kinds of things in mind, righting a wrong that comes about with discriminating against people with prior illnesses, helping small businesses and individuals find affordable insurance where there's competition and choice, and three, advancing the research that is undergoing in the nation today, where we really are going to have some tremendous breakthroughs that will be good for people's quality of life, but also for their personal pocketbooks and for the national pocketbook. There is real opportunity here. We have to change this healthcare system. We can't continue to say, no, we can't. We have to say, yes, we can. And that's what I want to see as we move forward with this healthcare debate. And with that, I'd yield back to my friend from Kentucky.